So I'm here today with Dr. Vesna Garovic. She is Division Chief of Nephrology and Hypertension at Mayo Clinic, and she is our Corcoran lecturer for the hypertension scientific sessions. And so we're very pleased to have you here, and very pleased. She just gave a beautiful lecture. So, so tell us a little bit about yourself.
Thank you very much. I have to start by saying that it's been an amazing recognition and honor to be the recipient of this award and to give memorial lecture. And as I mentioned that to you earlier, I really put a lot of time putting that lecture together. It was a really opportunity that I did not want to miss to present the research that I'm currently doing with my team in the lab. So my career was not straightforward in the sense that I started as an obstetrician. I was fully trained OBGYN surgeon. And during my residency in OBGYN, what I really liked the most was maternal fetal medicine and internal medicine part of taking care when it comes to pregnant patients. What was really not something that I liked was the fact that I was spending too much time in the OR and did not have time to do enough of lab work and research that I wanted to. So after I moved from my home country, which is Serbia, to Canada, I did master's degree in molecular genetics at McGill. And subsequent to that, I decided to pursue internal medicine training and nephrology because I really wanted to do and to grow further and to develop the field of obstetric nephrology, which is increasingly getting recognized as a field which is quite important as it's at the crossroads of internal medicine and obstetrics, especially now with having women with first pregnancy in their 40s, sometimes in their 50s. We are seeing more and more internal medicine conditions, hypertension, and kidney complications in our pregnant patient population.
So Dr. Garovic is an expert in preeclampsia. That's the main focus of her research. And not only does she do clinical research, but she also does basic research into the different mechanisms responsible for preeclampsia. She's particularly interested in senescence-associated mechanisms and how these senescence proteins are upregulated, particularly in women who have preeclampsia compared to women who have normal pregnancies. So if you tell us just a little bit about your work.
So I think it's known for decades now that women, especially those with early preeclampsia who deliver in 28, 30, 32 weeks, we know that placenta from these pregnancies are showing ischemic changes, infarcts, and vascular changes that are actually characteristic for more advanced pregnancies. Typically, we see these changes at 40, 41, 42 weeks of gestation. And we know that. And we know that these ischemic changes and placental infarcts are leading to babies that are small for gestational age because they don't receive appropriate blood delivery because of the placental insufficiency. However, the mechanism of these advanced atherosclerotic changes and accelerated aging of placenta was never fully understood, even though these changes, pathological changes, have been recognized, as I already mentioned, for decades. So when the whole field of senescence started, my first instinct was, is it possible that senescence, which is one of the mechanisms of aging, may be playing the role? And from that angle, we approached both clinical as well as preclinical studies in my research program. So at the level of preclinical studies, we developed an animal model of preeclampsia, which is based on IL-10 knockout model. And it's important to understand that IL-10 deficiency has been associated previously with accelerated aging and senescence. So this model, after the treatment intraperitoneally with human preeclamptic sera, recapitulates fully phenotype of preeclampsia in human pregnancy. And that was really the first sort of finding that initiated additional experiments and studies that we did with the clinical material. When it comes to women with preeclampsia, we have done several research projects that actually did entertain and supported the idea of senescence playing the role. We showed that epigenetic aging is accelerated in women with preeclamptic pregnancies, even during their pregnancies. For example, women with preeclamptic pregnancies, even though pregnancy is only for 9 months, they based on the epigenetic clock, they age 2.4 years. And women with normal fancy pregnancies, they actually age a year, which is normal for the pregnancy that is lasting 9 months. So that was one interesting finding. Then we actually looked into all clinical material that we are able to obtain during C-section of these pregnancies. We obtained fat tissue from these women during the C-section, and we did some additional experiments showing that indeed some of the markers of senescence are upregulated, and we also isolated mesenchymal stem cells, which are necessary for normal angiogenesis, and we showed that angiogenesis as induced by mesenchymal stem cells is impaired. We were able to recover the normal proangiogenic phenotype by treating these mesenchymal stem cells in vitro with senolytic agents, which actually cause apoptosis of only senescent cells.
So one of the other things that Dr. Garovic, a new paper that she's just published, is we've known for a long time about preeclampsia and all of the conditions, and it's sort of been, if the woman gets past her pregnancy and everything is good and the baby is born and everything is good there, then it's okay. But she just published a wonderful paper looking at women as they age, and with aging, those women who have had preeclampsia and women who have not had preeclampsia, and looked at their cardiovascular risk. So yes. You want to tell us about that?
So when we are talking about long-term outcomes, this is now me as a clinician doing clinical research. We know that multimorbidity is a surrogate marker of accelerated aging. And in 2 papers now, and there is a third one which has been accepted and will be soon available, we are showing that women who had preeclamptic pregnancies are at risk for multimorbidity, which is a marker of accelerated aging. Not only that, we show that women when in their 60s, when we check some of the markers of senescence, actually do have upregulation of these markers, even at the time when they are completely asymptomatic from the clinical standpoint. We were then able to follow these women for 7 years and to show that indeed they develop additional morbid conditions such as coronary artery disease, stroke, and similar cardiovascular events.
So the other thing is that Dr. Garovic, over her career, has been a very strong mentor for young investigators, and she actually has a STAR grant to support residents who want to do research and learn how to do research. So, and clinicians, scientists are not as prevalent as they used to be. So what advice would you give to a young person who's just finished medical school, would like to do research in the future? What advice would you give to them?
So you're 100% right. Clinician scientists are becoming an endangered species. And for that particular reason, despite being very busy as the chair of Division of Nephrology and Hypertension, as Dean for Clinical and Translational Science, I took another task, which is to support institutional efforts in developing clinician scientists. I think for young physicians who are just starting their careers, I think it's very important that early in their career, they understand what the science is about, how that resonates with their overall career plan and academic ambitions, and to find good mentors and people who are supportive, and to go to the institutions when that's going to be possible to do. Because we hear quite often people 10, 15 years after the clinical practice saying, oh, I wish I pursued the research that I had interest for, or I wish I had a mentor like Dr. Reckelhoff, who will point me in the right direction. So I think that early in their careers, they should explore the opportunity to do research and then figure out whether there is something that they have passion for and pursue that as the part of their academic career plan.
Okay, thank you very much. So congratulations again on your Arthur Corcoran lecture. Very well deserved, and it was a fabulous talk.
Thank you very much, and it's really, I cannot tell you how much honored I am to be the recipient of this award this year.
Thank you.
Thank you very much.